I want to talk to you about what is minimally invasive surgery. There's a purpose to doing a surgery on the spine. Maybe the patient or you have a disc herniation, maybe there's spinal stenosis or a slip disc. There's a variety of reasons that we would go in and do a fusion or a decompression of the nerves in the spine. Minimally invasive surgery entails doing that but causing as little collateral damage as possible. So the goal of the surgery is the same. We would still be, if we wanted to do a fusion, we would still be doing a fusion. If we wanted to do a discectomy and decompress the nerve, we would still be doing that. Minimally invasive surgery describes the approach or the way we get in there and accomplish the goal of surgery. Typically and historically, if a surgeon was going to do a lumbar fusion, they would make an incision in the middle of the back, and then they would open the muscle off of the spine. And they're working in a pyramid or a cone where you need to have a large opening for a small target in order to get the instruments and the light down to that target. Minimally invasive surgery basically is to work in a cylinder where your target and your opening are the same. You're not working in a big cone, you're working in a small cylinder. Usually we're going through a channel through the muscle fibers as opposed to separating the muscle off the spine. And the instruments and the light source and all of those other kinds of tools are designed to allow us to accomplish the goal of surgery without all the collateral damage. The advantage to minimally invasive surgery essentially is a much faster recovery, typically less blood loss. In the right hand, sometimes minimally invasive surgery can be more efficient or faster because we can get to the target more quickly. And the patients, I think, probably have a slightly improved long-term outcome, but the long-term outcomes are fairly similar in the literature. And that's because the goal of the surgery is still accomplished either way. It's that the recovery with minimally invasive surgery is faster. Not all surgeons do these approaches. There are some types of minimally invasive surgeries that some do and others don't. Endoscopic surgery is a type of minimally invasive spine surgery that not all surgeons do. I think it's something just to be aware of. Minimally invasive is used in advertising for surgeons a lot, is I'm a minimally invasive surgeon, and I think that's okay. I think though that generally speaking, it's just important to understand it's a way of getting in there and getting out by causing as little collateral damage as possible. The patients typically have a faster recovery and a similar and maybe slightly improved long-term outcome.